Atanineani, ani mai, veige saute. Quella ie ui ae o tu felenite. Homo mai o kange, amo erile. O pehe ange mai, e hoko maupe. Folau ka pasang heihe, ala tau fa. Amerika lahimo, ono folaua. Ono ea whakalata mai ke te kita. Ki te noa maupe, si i fungasia. Te uhi vehi vape, mo fie fia. He ala o manongi o e kau mea. Tuku ke mo oni a e ki ilea. Misi e fuku o mama, kone a whaingata. Folau ka pasang heihe, ala tau fa. Amerika lahimo, ono folaua. Ono ea whakalata mai ke te kita. I te noa maupe, si i fungasia. Te uhi vehi vape, mo fie fia. He ala o manongi o e kau mea. Tuku ke mo oni a e ki ilea. Misi e fuku o mama, kone a whaingata. Misi e fuku o mama, kone a whaingata. Misi e fuku o mama, kone a whaingata.
Welcome to Voice of South Pacific, a Pacific Islanders broadcast from Seattle, Washington. Ko e whamawhalea ai ni ai te teo le o Pacific South o atia pe me Washington ni Amerika, me he mana mo i center. Ko tau prokalama ko e ahoni te tau kamata aki ai tau kauwhataha pea mo e taha o e kautaki ko ia i he te whaki ko ia ai King County Public Health ai ko Christina Bradic. Christina Bradic has been working with us supporting our Pacific Islanders community for more than a year, and we're so grateful that she took her time to help and support to keep everybody safe. And so we're so thankful, to have people like Christina, that she has been sacrificed her time all last year up this year, to keep supporting our Voice of South Pacific broadcast to get the message out to our Pacific Islanders listeners. Ko Colin ke hiu whangai pe ngai talwhatap ko tape ko osana whaki kai lava ke tuka te tau polkalama koe ni he aho ni. Ko e ahu a waluen o e peleri o e wanoa woa. E ko kole ke u whatapat mo ke ho eki ko tape o e whanua. Le pe ke kainga tonga ko tape mo mea mai ke tau polkalama o e aho ni. Ko polkalama ka mai ni mau kau whatahen mo Christina Bradic. Ko e tō tahe ne toka ngā e ta whaako ia wa ai whetu taki me he King County. Ai koe King County, that's the county that we live here in Seattle. Ve i he konga hono wā hako to tonu ai hono, te tau kolose ki tonga. Ke tau kau whatahe mo kau ngawe koe e kastomu. Ke tau whanongo koe ngā koe container mo ngahi ofa koe ia nei whaka nei awe ki tonga. Koe ni kua o lelei mai. Ko ia, welcome Christina. Thank you so much, for taking your time to always be with us and supporting us and give us, the update information. Christina, can you hear us? I think that's from our end.
Oh, yeah, sorry.
Yeah.
Sure.
Go up a little bit more. Hi, Christina. Can you hear me now?
Yes. Are you able to hear me?
Yeah.
Perfect.
Loud and clear.
Thank you so much for having me on.
Yes, thank you. Christina, before we start, I'll just take 20 seconds because I have some people here that wanted to send me their question.
Yeah.
I would like to ask Sili Kalepo. He took the time to come and help us today with our technical operation. Sili, can you just play any melodious song right there on the screen, or the last song that you played? Or Toli Fisi? Thank you, Christina, for being patient and working with us. The words is not enough to express our sincere thanks, for your time. For more than a year, you have been very supportive with all our Pacific Islanders events, and not only that, but advising to people and keeping us updated with all the information, from our King County. So, Christina, my first question right now, they're coming from one of the church leader. What's the latest update on compared to the COVID-19 since they lift up, the mask mandate? Can you tell us, what's the latest update on any social health services or the COVID-19? Thank you.
Yes, and thank you so much for having me and all of your work in the community. It really makes a difference around COVID-19. The current state of COVID-19 in King County, you may have heard, cases are actually quite high right now. We're at about 230 cases per 100,000. And to give you an idea of how that compares, this is what numbers were around the winter of 2020, before people were able to be vaccinated and when COVID was quite severe in the community. The positive news is that hospitalizations and deaths remain low at one of the lowest points we've seen. So this tells us two things. One, it tells us that the vaccines are very effective at protecting against severe disease. Even though people are catching COVID, they are not needing to be hospitalized, and we're seeing a lot less deaths. But this also tells us that there is a lot of COVID-19 in the community. And for people who are vulnerable or people who are unvaccinated, there is a high risk of catching COVID-19. So even though there are no longer mandates about wearing your mask, it's still a really good idea, especially in crowded places. You want to continue to do all those things that we know work really well to prevent COVID-19, including getting vaccinated, masking in crowded spaces, and making sure you have good ventilation. If you're inside with a lot of people, maybe open a window or open a door just to get air flowing. And we know that really helps. But even though numbers are high like they were near the beginning of the pandemic, the difference is now we have vaccines that work, and now we know other measures that work to protect us.
Thank you so much, Christina. Hangi ko ka ngai whamatala ne ngopek toi alu hake tu unga ko kai mahaki tai mini. I he wahengani. Ka koe mea whawhiawhia ai ko ngā he pia e huhu malui. Pia iai whaki hangi ko ngahi mask ko ia mo ngahi tutu ni ko i ke laiwa o whakahawhi kai kakai. So I have this one question here from one of the community leader. I know that has been asking there is a fourth dose that is available. Does the fourth dose have a role in protecting against severe disease?
Yeah, so people who are eligible for a fourth dose of the COVID-19 vaccine are people over 50 years old. If you've spoken with your doctor about having a severe being severely immunocompromised, you're eligible for the fourth dose. And if you had Johnson & Johnson as your first dose, you're eligible for a fourth dose of COVID-19. These are options that are available. And what we know is that boosters in general have shown significant protection, especially when it comes to hospitalization and deaths. And numbers are lower for people that are boosted than they are for people who just had their 2 initial vaccine series. So we know boosters are very effective, and they're available for people who are older or immunocompromised. For people who are not older or immunocompromised, right now, just having your booster provides a lot of benefits, and a fourth shot is not necessarily needed. But you definitely want at least 1 booster shot after having your initial vaccine series.
Right. Thank you so much. Okay, I have another question that coming also from the church leader. What does a fourth dose do to the body? I heard it's the same as the third dose. Could you please clarify that?
Yes. So in terms of medication, it is the same as the third dose, and it's the same as the first dose. So when you hear about booster, it's not a new medication or a new vaccine. It's using the initial vaccine to get stronger protection against the virus. So think of it a little as if maybe you were taking allergy medicine or Advil, and that medicine is going to work really, really well until the protection wanes, and then your headaches might come back, or you start sneezing again. So it's kind of the same with the COVID-19 vaccine, but on a much bigger picture. And what scientists have found is the vaccine provides very good protection against COVID-19, but after about 6 months, there's something that's called waning immunity, and that protection lowers. So then a booster dose helps bring that protection back up. Just as if you took Advil, we're starting to get a headache, and you took another dose of Advil and the headache went away again. And this is similar to many shots. This is why a flu shot is recommended every year. This is why when there's children, they may have 3 shots in a row rather than just 1 shot. So boosters are very normal, but it is the same medication. It's just helping keep that protective effect going longer.
Thank you. Well, we're also very lucky today that we have Sili Kalepo. He's the project monitor, like for our Pacific Islanders. And he's joining with us right here, helping us, with all the technical part of the operation today. Hope, Netta, you can feel better, with your son. Sili, do you have any question at this time to ask?
Me? Oh, no.
You don't have any question. Okay. I have another question here. I heard on the news that Omicron is an infection, not a virus, and I'm a little bit confused. Can you tell me about what's the detail on that? If Omicron is an infection or a virus? Thank you.
Yes, thank you. That is a great question because I think, especially a lot of places, these terms are used separately, but often in the US, these are interchangeably used. So how it would normally put is a virus causes an infection. So the Omicron is a virus, and some people may call it an infection, but it's those are the same thing. It's different than if like an infection like from dirt in a cut or something that you might need antibiotics for. This is an infection caused by the virus. So when you hear Omicron virus or when you hear Omicron infection, those are just different words for the same thing. And Omicron is a variant of COVID-19. So these are all COVID-19 viruses. And Omicron is, as we've talked about, the virus will change. And then it looks just a little different. And then it's almost like you have a family of viruses. And Omicron's like a cousin.
Thank you so much, Christina. Hanebe ko yan ane whamatala I mai ko e tau whanonga pegi he ngai mea koni ko ngai whatotolo whasai ni sena kautoketa ko e Omicron ko e virus pe ia ka ku pehe whakewhangani ia na ko ha siemu pe pipihi pe ku totolo ka koe ni utoe whamahino mai ko e Omicron ko e virus pe moia. Okay, the next question here. How about the too much vaccines? Will that have any affection because I already complete my 3rd dose? The 1st, 2nd, and the 3rd dose. Now there is a 4th dose. Will that have anything, to affect my immune system, or I can just stay with my 3rd dose, or do you think it's very safe that I could go with the 4th dose?
Yeah, so right now, 4th doses are available, as I said, for people 15 over or people who are immunocompromised. But if you have 2 vaccines and your 3rd dose is a booster, you have very strong protection right now. In terms of too many, one great thing about this vaccine is it does not, the vaccine is injected into a muscle in your arm. And then right there from that muscle is where the immune response is built. So it isn't swallowed, it doesn't go into your liver. It's not like taking a lot of medication that might damage you. And in fact, within 3 days, the vaccine is completely broken down by enzymes and it's no longer present in your body. So it is very safe. So if you are eligible for that 4th dose and you'd feel more comfortable with that extra protection, it is absolutely safe. One thing that sometimes with the later doses, people might get more side effects than they felt initially. I know that I did not feel My first or second dose, I had no side effects. My third dose, I was a little more tired, but side effects are different from everyone. But in terms of your health, the vaccine is very safe and actually gets out of the body really quickly.
Thank you, Christina, for clarifying that. Hage pe na mo whanau mai ke ai, ko fourth dose o ko hao le le pe ki ho tau sino. Ko si whai nau ngai whātau tolo e kau sainis matau tau, pe aku ilo ai, ko e huhu hono whā o ko kei hao whikina pe ho tau sino, pe aku tokoni whoki ke ne hanga o wha hao whikita, me ngai sie mu pipihi ko ni o kulolotonga mawhola i he taimini i he ātakai. Ko iai, o ki kai ke pehe ke ia ne kaunga ke ne hanga o we siato sino, ka koi fie mau pe ki te ngawe aki, pe o ki kai ke ngatai, o kai pe whangani i ia, we mea koko side effect, pe ko ki we sia pe ia, ka ki kai ke ia mea whakatu tā maki ahi ko nau o si sivi, taimi lahi pe ko nau o si hanga tesi, ke mahino o sai ke koe pe moa. Thank you, Christina. So like it's about 20 minutes after 5, I could ask Silly, to please if we could have a little melodious song, for only 20 seconds, then we'll move on to the next questions. Thank you, Christina. I know you'll enjoy our melodious song. Yeah, I have a question here that we can continue. Thank you so much, Christina. What is the new requirement, from the Seattle King County Public Health now? What is the new requirement?
Yeah, so right now, requirements and mandates are put in place to make sure that in case of emergency, the city and the county are able to provide you with the things you need, such as hospitals and emergency care. And that's why we put on mandates to make sure, because hospitalizations were so high that COVID was putting those services at risk. So there were mass mandates to bring that down. Right now, King County does not have any mask mandates in place, except in healthcare centers, and no vaccination requirements in place. So keeping this in mind, a lot of businesses may still ask you to wear a mask, and businesses may still ask for proof of vaccination if that's the choice they make. But in terms of what King County is asking, there are currently no mandates.
Okay, I'm sorry. What was the last part, Christina? That you said that the King County was required?
There are no mandates right now.
No more mandates, eh?
No more mandates.
Okay, I have this question here that just texted me from Marine Ansi. Marine Ansi, she said, I'm working part-time at the airport, and now they lifted, no more wearing masks. Do you think that this one here is happening all over the country, or just in Washington State or King County?
Yeah, it is happening all over because, so just an interesting side note, airports and airplanes are counted as federal transportation. So those are decisions that are made in Washington, D.C. And so on the federal level in Washington, D.C., there was the decision that masks were no longer needed on transportation. And that can be controversial. A lot of health experts say it's still a very good idea to wear them on transportation. And of course, a lot of factors play into that, such as how crowded the space is. And so there's a lot of things to think about. Some areas are still requiring masks, such as the LA airport, but this is not something just in Washington state. This is all over the country where air travel no longer has masking required.
Ko ia hange kona nei tukuange mai. Ko ne whakaata whakakatoa pe i Amerikani. E katoa e ngai state kone ni manoa. Ko ke toi whia mao ke tui ko ia ai mass. Tuku ke he ka pa o ke ai peha kautaha ia nau loto pe ke nau ngawe aki. Ka ko tu ko tai mini o sto e whataptapui. Okay, I have another question here that just came in from James Little. James Little, he was asking if the virus is going up here in Seattle, King County. Is it most likely it's going to stay the same, or we're going to go to another restriction? What can you tell us?
Yes, I wish, I think a lot of us wish right now that we knew what the next steps were and if cases are reaching the peak and then will drop, or if cases will continue to rise. A masking order will be put into place if hospitals become too crowded. So looking at hospitalizations and looking at deaths, if those begin to climb, or if levels are so high that it's going to perpetuate the spread of COVID a significant amount, it is possible that a masking order will be put back into place. But if numbers begin to decline shortly, or and hospitalizations stay low, things will stay as they are with no mandates. So that's what we're looking at. We don't have any affirmative answers on what will happen at this time.
Okay. Kone na ne osi hanga pe tuku atu. O tigai ke paha toi ilo pe koe hae lewa e tunga kone haukat ki ai. Ka koe tu koe taimini. O tigai ke toi yaha mea. Hatu tu uni fo o. Koe whengai pe ke tak tahtauhi pe ai mo uilelei, mo whahauwhi koe, mo whengai pe ke whapotapota pe he mea kotoa. Hange koe ngahi ātakai o whaia whiohi i he society. Mo ha ngahi mea pe whakatokolahi. Pe a totono pe koe hape mea te ke ilo e tokoni ka koe ke malu i koe. Koe a ko whamalo tēni. Koe lisi taka whaatu vea ka pa ukaha o whehu i ke kau mai. Koe ni mau whewhia ke tau kau whatahe a honi. Koe ose ni mau kolos te ki tonga. Tau kau whataha pe a moe si o koe kastomu. Pe whake atu Ariana tu i vai lin lo li teo. Koe ali alini. Te wai pe koe haa peha mō wheu i mō whakarea mai ki he tau CEO koe kastomu, koe ngā koe ngai tokon ko te pena e whai. Pe whoki kia Edwina, malo a pita kau mai. And also Samu, I think it's a Somalian name. If you guys have any question, feel free to write it and then I can be able to pass it on. I just have this one question here that was just texting from the people in the community asking about what's going on right now with the King County Public Health. Since we don't have any more mask mandate or required, for vaccine verification, are we going to end them, or it's still required, to continue on? I think they're asking, about the COVID-19 testing and the vaccine. Is it going to be still going on to make it available, or they are going to come to an end if, if all these restrictions are taken off? Thank you.
Yeah, so right now, there are still free vaccines. So if you need a booster, if you have not gotten your first shot yet, the vaccines are still free to anybody, regardless of immigration status or insurance status. And you can go to kingcounty.gov/vaccine to find a list of places. And also, I'm going to put a community event calendar in the chat box where you can find free vaccination clinics in your community. And I'm also going to put a resource. So every household in Washington can get 2 free COVID tests a month. And I'm going to put that website in. The website is sayyescovidhometest.org. And free testing is available there. You can also find testing centers at kingcounty.gov/COVID and look for testing information on that page. So right now, those continue to be available. If we continue to move out of the emergency state, there could be changes on the national level and in King County where there might be a small fee for the vaccine if you're at your doctor's office or a pharmacy. But right now, vaccines are still free and you should not be charged any fees if you're at your pharmacy or a physician or at a clinic. And I just want to note that the reason that mask mandates have gone away in vaccine verification status is because so many people got their vaccine and people test and they're very aware. And together, those two things have helped the COVID levels go down to the point where masking and vaccine verification are not needed.
Thank you, Christina, for clarifying that. I had this one of the people from those PI community. I'm so sorry, Brittany and Tiara, for not sending you guys the Zoom link. I was not sure if we're able to do a program today, but thanks Siri Kalepo. Now, Siri Kalepo is the project monitor for the Pacific Islanders, for taking his time to come out and assist us on today's program. By the way, I think that the question that they wanted to ask about all the things that is happening right now, is are we just like dealing with the Omicron, or is there any other baby virus is coming up?
Yeah, so right now, it's normal for the state to look at what strains of the virus are in Washington. And right now, Omicron is the predominant virus if you're infected in Washington state. And you might hear about 2 Omicron viruses, and those are BA1 and BA2. And right now, it's about half and half in Washington state. So Omicron is what we're dealing with. For variants, it's hard to say when new variants will come. Usually those are unexpected, but currently there are not any other variants of concern.
Thank you. Hange koe ka whamatala Christina. Tu koe tai mini koe ke tai yaha whainga variants koe ka any virus o toi iloi ke toi hokat ki ai. Ai maha koe o whange pe ko tau ngata pe ni he Omicron pe tau ngata pe. Thank you so much, Christina. We'll ask, our technical assistant today to maybe play this little next melodious song, for 20 seconds, and then we'll continue on while I have a couple more questions to go.
Sounds great.
Maleta uanga fa
Christina. I have this one question here that coming from, I think it's like Paul Woodry. Thank you, Paul, for joining us. The question is asking, can you tell us, about, I think I just came in late, but I know that you were talking about it in the beginning, about the status of the people that are here in King County and Washington State. I know it's rising up, but I'm talking about the people that maybe lost their lives, from based on the virus, the Omicron. Do you think that it's like the same, that it's going up, with the people that lost their life, or it's only the people that get sick from the virus?
Yeah, so correct. What we're seeing is higher number of cases. So cases are rising. So that's something to be really, really aware of. And just, yes, we encourage everyone to make good choices in terms of wearing masks when it's crowded and taking precautions against COVID-19 and making sure you have your booster. So cases are on a rise. They've risen 23% since last week. And that's been a steady pattern we've been seeing. Hospitalizations are also have a small increase, but very few people are hospitalized, maybe about 10 per week. And deaths have been dropping significantly. So what we're seeing is people who are vaccinated, they might test positive and that's recorded as a case, but not have a lot of symptoms, or it's an illness that feels more like a cold and they can rest at home and isolate there. But the number of people where disease is very severe and needs hospitalization, that number is still very low, as well as deaths. And what we're seeing is booster shots make a significant difference in that. So I'm just, pardon me, I'm just bringing up the most recent numbers. But if you are not fully vaccinated, you're 5 times more likely to be hospitalized than someone who is boosted. And if you're not fully vaccinated, you're 24 times more likely to die from COVID-19 related causes than somebody who is boosted. So it really is the vaccines that are keeping these hospitalizations and deaths low.
Koia hange koia nai whamatala mai koia e Christina, mo whamare more pe ko e ngahe koe lea whapapalangi pe nau lawa ke nau ngawe aki. E whai pele le taha ke tokonia ke tuku atu i he rea whatonga. Koe ui ngā koe pehe koe hae toko lahi ka kai koku more nau mo ui. Koe mahu i ngā pe ke ngawe aki, tino ai huhu malu i. He si e ngai ka kai koku more nau mo ui. Ka kai koku nau ngawe ke huhu malu i. Pea oku i kai ke loko we sia ki nau tol o a more nau mo ui. Ka pau oku lo ho immune system, pe koe ngahi ta whākau nau tau e maha ki i ho sino, pea ka pau kai ke ngawe ake ai huhu malu i. Oku whaingofua lewa ke ne toi we sia ai ngahi ta whaaki kehe i ho sino. Ko ia u nau kole mai, mo whamare more ka mo ngawe ake ai huhu malu i. It's always best to take the vaccine and the shot to protect you and protect others, because it's better to prevent than cure. You know, ko ngawe koe huhu malu i, ho malu i a koe i ha toki hoko maha whaingataa, pia ke toki whakaise isa ke alu o ngawe ake huhu malu i. Thank you so much, Christina. This is my only last question. It's coming from us, from the Voice of South Pacific. Do you have any other social services, for the community? Like before, they used to have the rental assistance and other, maybe other health services that we may not be aware of, that it's available for the Pacific Islanders community. Thank you.
Yes. So King County has a program that's the Community Health Access Program. And so with COVID-19, things like rental assistance and programs like that were put into place. And unfortunately, as funding ends for COVID-19, programs like that are ending. But the Community Health Access Program, which people can find by going to kingcounty.gov/CHAP, CHAP, provides a lot of community services. So you can speak to somebody and you can ask, you might be qualified for energy assistance or grocery assistance. If you don't have health care, they can help you enroll in free or low-cost health insurance. If you need some routine health screening, such as a mammogram or cervical cancer screening or colon cancer screening, they often provide that free of charge, as well as many other things. Let me pull up the phone number that people can go to if they'd like to speak to somebody. So again,
the phone number for the chat.
yeah. So the number, if you'd like to call
On my page,
and see if you qualify for help, is 1-800-756-5437. And translation is available when you call. And you can also send an email to CHAP, CHAP, at kingcounty.gov. And you can ask them question about services available and if you qualify. So again, this is insurance. This is if you need a doctor or a dentist and you need to be connected to somebody, if you're pregnant and need prenatal support, if you need help with groceries, if you need help with electricity, if you need an Orca Lyft card to help with transportation, all of those services are available. So if you visit the website or you contact them through phone or email, somebody can help connect you to services you're eligible for.
Thank you, Christina. Hi, Salonga Queenie. Thank you so much for joining us. Could you please repeat the phone number one more time?
Yes.
Oh,
The phone number.
It's a chat from the King County website? Okay.
Yes.
I'll drop it in the.
Perfect.
okay. Thank you so much. Christina, thank you so much, for all the great information. And we know you're always on the top of it. Ko mea kono whai Christina, ko whia tō koni, ki he kai ngā tonga, tō koni ki he kai o Pasifiki. Pea neong pe tau tō taha tō koua e tau polo kalama. Ka o sea ko ni alue ke nau ngai group o ia anau tōlu. Nau ngai group chat e anau tōlu, pa anau tō ke hanga anau tōlu. Lili wia ke nau ngahi polo kalama whaka community, ke tō koni, ke nau ngawe aki pa ngahi information ko ni. Ko whawhiawhia apito ko ngā ko si lava tuku he tō tahani ene taimi ko ngā ka tamu a ke tō koni mai ki o tau kāinga. Thank you so much, Christina. And I'll leave this last few moments for you. Before you leave, please, if you can, give us, any final conclusion to, information that I may not even ask a question about it. You think it's maybe information that is relevant to share with the Pacific Islanders community?
Yeah, I think the main thing that's really important for people to know is COVID-19 is still here. Sometimes you hear that people say, I thought since the mandates were lifted and we don't need masks or we don't need vaccines, that we could no longer get sick from COVID. COVID is still in the community. So the same way, if you knew somebody had the flu, you probably wouldn't go stand very close to them, or you wouldn't want to be in a crowded room with them. And you take precautions against getting sick is a normal thing that a lot of people do, whether somebody has a cold or a flu, and you want to continue to do these precautions for COVID-19. Even though we're no longer in a status of emergency with lots of mandates, COVID-19 still exists and people are still getting sick from COVID-19. So it's really important to do all of those things that we know work. So don't hesitate to wear a mask. Make sure you're up to date on your vaccines. It's not too late to get your first vaccine if you're still wondering if that's the right choice for you, but I think it's just important for people to know that COVID-19 is still in the community, and everyone has the power to make choices to help stop the spread.
Thank you so much, Christina. We do appreciate your time and thank you again, and we look forward to have another program with you in the upcoming week. And then we have this beautiful song that was composed, by the former Queen of Tonga, Her Majesty, the Fuiva of Ataputu'ukai Aikause. So we're going to play that song, it's always a beautiful melodious, come all the way from the islands of Tonga. It's like Tuka Aikause, it's like a beautiful flowers, it's exactly like that called.
Holy fishing bear, I call now my. Holy fire, Nakari. Alano hua oga malu e Ono ai e ha okupetaki.
Thank you so much, Christina.
Holy fishing bear, I call now my. Holy fire, Nakari. Alano hua oga malu e Ono ai e ha okupetaki. Tukai ai hase, ia me te kite. Ito ilua hama e ni aku whai wheluteri. O tu mai ha mai, ko mai ua ko. Mali kai hoho e loko. Ilo peta kai silo mai le momo. Pero kakau ka soso. O tu mai ha mai, ku vai ua ko. Mali kai hoho e loko. Ilo peta kai silo mai le momo. Pero kakau ka soso. Tukai ai hase, ala mea te kite. Ito ilua hama e ni aku whai wheluteri. Tukai ai hase, ala mea te kite. Ito ilua hama e ni aku whai wheluteri.
Koe whangamari whakoe ni te utuko tai pēa ki nau tau koe nau sponsor e Polo Kalamani koe market fisi ai au iloa koe Fiji Market. Fiji Market o ki ai whaki ai talo koe ka koe kapapulu koe sipi pēa moe la i lū whaki. Kai whaki moe ngahi nau koe ia mehe Pasifiki hange koe ngahi kahoa koe ngahi teu koe ia o ka kai whiwhine kai pehe whaki ki he ngahi whalani mo ngai tata koe ke kakai tangata, pia ku asi pia e ngahi ngoa kehe. U maa whoki ai hakalo vau niu, ke ngawe aki le vai whainga maria i he ahoni. Whitu taka ke pe koe ke Fiji Market, Fiji Bonanza, 253-839-0252. Koe Fiji Market u tu ia i he Kent, i he Military Road koe i Kent, koe telefoni koe wani matolu, walu tolu hiwa no wani maua, o kua vai ia i he aho e fitu ko ia wike, me he taimi hongo fulu pongpongi ke he taimi fitu e fiafi. Mo me ake pe ki ai kakato koto ai ngahi mea toko ni whakatonga ke ngawe aki. Yeah, we're going to play one more song here and then we'll continue on. the same song, you can play that. Or any song that it's available.
Tau ta ta awana fa au ngai le tama na alanga yo sua awe ina ia tu mau olela lana finanga lo ia faia o manu ia na ole taua na no ho oe o se au na le au
Koe ka whamanata te pe whaki, koe ngā koe hokotautan kai ono, tau kolose ki tonga, tau tari mai whaki ai pulelahi koe ai kastomu pia moi wafu, i tau kau whatah mo ia. Welcome Teko, only a few minutes we'll cross to Tonga. I tau prelulu koe wei ko osi na tau kau whatah whaki heni pia moi President ko Amerikani, President Joe Biden, na ane tu uta mai foki se taloni I he to prelulu, he fiaf to prelulu, I he taimi ni mai fiafi, pia koe ahwhalaite na ane a takai holo ai, ke he ngahi wheituu ke kehe, o ka wai foki a Green River College, koe ia I Albany. Koe tau mua foki ne a mai, koe ne whenga ke whai hatalanoa ke ngahi whakamaa koe ia oi a takai pe koe clean energy. Ai koe clean energy, koe hange koe whenga I hange koe ngahi kohu, pia mo ngahi mea o kune whakatupunga ai atakai ke fulahi, ai e fu mo uri ai, pia I kai ke ngatai, mo ngahi mea pe whatupu ai mo ke mikare, pe ne uesi ai manawa koe ia ai kakai. Koe ia nai pehe whoki Joe Biden, whafo ofa au pito ai wheitu uni, tahene ngai wheitu whafo ofa koe Amerikani, pena ane fia foki. Koe ngā pehe foki e White House, o nā loto ke tuku atu ai pa angai tolu ngā wal nima, ke tokoni ke ngai whamiri whakatau taha, koe ngā koe sio koe ni ke ngai tawhaaki koe ia, pea moe tokoni, koe ngā koe hange koe ngahi uhila, moe ngai tawhaako tau pe whakalere aki ai uhila pea moe hange koe interneti, ngai tawhaako ia. Pea ko ia ai o punau te teu peke o mai e paanga e ono poini nima miliona ki Washington State ke tokoni atu ke kakai ko ia state ko ni. Pea ko ia ai nai pepe e tō tahani o ku whaampe te ahano whanga maari e ke toi a ahi mai ai ki heni. He tu ko ia I he lolotonga ni o ku ia e tokoni lahi a pito a Amerikani kuna o sanga whakaata ai pota ko ngā ke lava hu mai kakai me Ukrainian una fuafua kakai toko taha kilo ke nā kumi hufanga mai ki Amerikani ko ngā koe whepaki koe ni pia mohono whenga koe ia a Lucia ke nā hanga mau I ai whanua o mate ai e nā kakai toko lahi ko laka ke toko ni mawhe ai kakai ko mole e nā mo ui I Ukrainian. Pia koe ia ai o whaatai Amerikani e whai mai kumi hufanga. Ko iai o ku iai mo ngahi tawhaaki ke o whai e kumi hufanga mo kumi tokoni ki ai ki tānaki a ngai seniti mo ngahi mea ofa o hange pe ko ia na e whahako I Amerikani ai ngahi tokoni ke a o ki Tonga ke ngai mea koe nai hoko ai. I sāpate koe ni o wiko o si na maongo I mawhana koe ngā koe whakaafi na e whakahoko mai koe Mission Sunday ai kainga fisi me no ate I Everett, ai a ko Pastor Arceli, pea me he Everett Community Church, pea na mau labat ki ai, pea na whawhiawhia whoku I nau tānaki a pe nau ki seniti, taim ko ia ma oe pāngai tolu awhe whange au tupu, koe mai koe mea ofa ke awe ki Tonga, ke tokoni ke ngai mea koe no hoko ko ia I Tonga. Ai na whawhifonga I ki mautolu vai o matoka malu, ko skeritari fokia e mau kulupo ia Seattle Tongan Relief Committee, pea na iai foku mo Angie, pea na aku kawat ki ai, pea mo Fololini Puloka, I e whafofonga I o tau community Tonga, Pea mo ngahi toko ni kono o mai kai ngā whisine o sa mai nau panga tolu awhet ki mua koe nau papaki upe. But we're so grateful for our Fijian brothers and sisters and also Pastor Aseli for taking a time to put out, this money to help the people of Tonga that were affected, by the volcanic eruption in the islands. Ko ia te koleng mo ke ta e te whaifasko ni, ospe ko ia maha koutu koe pia ki minitsi mehen ko tau kolose ki Tonga, ta tari me ai CEO. Okay, Silly, could you please play any song from the Islands Breeze? Yeah. Ano ba na yung may sound? Must be sound. Di amin kalaki ko ito fasya.
Matandeami, ami mai, veide saute.
Totahan ko totahan.
Wela ie ui ae o tu felenite. Hongo mai o kange, alo erile. O pehe ange mai, e hoko maupe. O lau ka pasang nei he, ala tau fa. Amerika lahi mo, ono folaua. Ono e a whakalata mai ke te kita. Ki te noa maupe, si i fungasia. Te uhi vehi vape, mo fie fia. He ala o manongi o e kaumea. Tuku ke mo oni a e ki ilea. Misi e fuku o wawa, kone a whaingata. O lau ka pasam nei he, ala tau wha. Amerika lahi mo, ono folaua. Ono e a whakalata mai ke te kita. I te noa maupe, si i fungasia. Te uhi vehi vape, mo fie fia. He ala o manongi o e kaumea. Tuku ke moponi a e ki ilea. Misi e fuku o wawa, kone a whaingata. Misi e fuku o wawa, kone a whaingata. Misi e fuku o wawa, kone a whaingata.
Yo, kono tau lotonga taitari pe ki kono tau lotonga taitari ki Tonga, kono ne pe ma kono whenga ke hu mai. Ka e tai mini to o ate pe whamalo he ni ki he whare koloa ko ia e kau whisi, una loto whoke nau toko ni mai sponsor mai ai polokalama ko ia ai Voice of South Pacific. Ai a pui ko Simone's Fiji Indian Polynesian. Ko whare koloa ni ma au pito e nā mea toko ni, paanga pe te au tō noa, posipi. We hai whake mani o ke, koe kawa, koe uwhi, pe ngahi mea kai kehe o mawai, koe kosi, koe ngahi ika, koe ia hau, koe ia fresh, koe ia pe meifisi, koe whare koloani utu upe o i he tawhaaki, koe ia o 7-Eleven, me hanga tupe ki he IKEA i Rentoni, e hala whātolu. Ai koe tua sila, koe tahaua ni manoa, Southwest 43rd Street, Renton. Tahaua ni manoa, Southwest 43rd Street, Renton, Washington. Aia koe hingoa wharekoloa, koe Shimons, Fiji, Indian Polynesian. Koe wharekoloani o tupe pe tawha koe 7-Eleven koe ia o hangatu ki he IKEA i he kauhala taha. O tupe i he Southwest 43rd Street koe ia koe Renton. Aia ko whala ka tupe i he kapau koe aluatu me i Seattle. Te ke whala ka tupe i he Home Depot o alatai pe whai hala koe ia. O hangea o whai hala tatau pia o ke aloi ki he Valley Medical. O tu uai ai wharekoloa koe ni e ta whaaki koe ia o e Subway sandwich koe katoa whanki i wharekoloa koe ni koe mai whare Hawaii i ai pe tu uai ai whare koe ni. Ofi au pito mai pe ki South Center e kauhala taha. Koe nau mau inga nau koloa o matu aki ma au pito mo wha atui. Koe nau puasipi pa anga pe te au tō noa. Koe nau mire mila kawa pa anga pe tō nima. Pea pe whoki ke ngai mea toko ni ke kehe o mao katoa mei fisi mei he Pasifiki. Koe tu asila tahawa ni manoa Southwest hala whātolu 43rd Street i Renton. Aia o kuofia tupe o hanga tu ki 7-Eleven ni. Pea i e kauhala taha o ki ai koe na IKEA. Koe te tā e peni o ia koe ni malo o pito koe ni tau kau whataha pea moe CEO. Io. Wha malo atu. Tau kau whataha pea moe CEO koe ni kune lotoni whoki. Ofa peku i hena teko. Nes teko ke kei loto. Wha malo atu heni e kere mete vahe ka koe Chief Executive Officer ia pe koe CEO ia ai Tongan Custom. Pea moe kau ngau e koe i wafu. Ma wha malo atu i he ia utonu atu ai container koe ia na e utat koe ate ngahi o wha ki Tongana. Pea o ku whalea mai Palestini e ton puloka. Pea pehe whoki e komiti hono kotoa. Nau kole mai ke whakahoko ata wha malo lahi au pito ki ate koe. Malo au pito ai si ngawe lahi ko mo whakahoko. Pa te utuko ate ki whainga maari koe ni ke whai mai moaha o ki i talanoa whekau aku mai mau container koe ni na e anga ni tu utat koe ki motolu i Tongana. Malo o pito.
Malo Silvia, wongo lelea koe?
Iyo, wongo lelea.
Okay. Uraki o matapu atu ki he hauei ki me tonga ko tope o mea mai me whonuarahi ni Amerika. Lawa e whainga maari e koe ni ke tau toi whilonga ki hiri ana i aho. Whiawhia pita ki ata whamatara ko i ko e ngā koe na e whai ki container. Ko container ni misia toko si tau mai, tūtalere e pita pita. Pena e whakako ke ngā ue aneafu, po ane pomu, ane mamatumu, aneafu. Pea au mako ki aho ni, oku toi si au pito e ngai whangitaramu ke tō ke lawa mai ka e ngā ma. Ka e ene te whamatara tuko, wai ngahi mea ko mahinga ia pito Silvia e pio ke uta koena mai misiato.
Koia.
Uraki, mahina nga te awe maa mo whakatotu ai komiti me hena. Maa ai whakatotu ai komiti. Lawa ke whao lere, pea maa, pea sai hono peki koe a container. Koe kātonga ai container me muri, o si whora mai me no sila maseria. Teo pehe koe rei tahain hono peki mai koe ai uta me muri. Kono koe maa kono peki mai, whai mo fua pita ngā kono whakahifua. O hi o tau pehe koe talamu e whao, ai whaka ai pāreti. talamo fa pe valo e paleti o se pate o repe ke mila pe hua pe fo ki fio to mai ke foi to ta ka o talamo valo to ta ha o talamo valo I mau ko a fo tu fai mo fu a bita ka matore na we fai mo fu ke mau to ki tua fai no to ilisi ko nga ko fo fai ko mau to ke ni ko pau ke mau a au ki tua ai uta content ke whakapapau o ku match pe ku mali ko roa ko tu uta mo elisi o mai. O ke confirm pe at that point in time ke whakapapau o ku ikai ke mai ha mea e le wasi hingoa kana kai ke o mai. Pe mai hatala mue na kai ke ase hingoa. Kai o sankai maunga ko he po ko ni e no a au ko kontena ko ni msiato. Match e mea ko toa mau au pito tau sia ke rei polo ngai talamu ai whakarerei ai olunga funga talamu ai tafa aki ke lava ke puria hare polo e o hiko mawe ko ke ala he pito sato e na mo fai ko miki ma be ma pe ma pa te so ke uta ko ma talamu fo o ko ke ya ha me de tisio ke ai wangi ko ngai uta ni ai ko ala kia o whakamaro ai he mau au pita ngawe me hena. Ko te starting point ni me ko tope ke o mai ka fono export. Ko pau ke stand e lava o mai at. Ka fai mo fu ngawe, fai mo fu identify fai mo fu ke mausio. Pe o mai ko ia fai ko sive ta mai ki matu fo. Neo mo e mau no fo hu America, ai hu anga mai ko ke ini mai trucks mai me be contrabands. Ke taimi tau pau pe ke mau fa po pe mau ngawe. Ke mga pe risk based ay mga profiling ay uta asideri ko hingoa mga pe o to ko na pida ke mga profiling ke select pe na foi portion o e content o fai ga ngawe ko ke pe ke mga to 100% se me ko to pe it's impossible.
Everyone knows just trying to get the customer account at the recycle center.
Ia o ko mai lotoni foki kataki pe Clemente mala mai lotoni pe amo neste ko fainga ko e pe fa ke haloti ko na wai na toka nga I ko ia ai mi tafaki ko ia pe mono na to ia I tai mina to frahi fa ko to uta ki tu aka na to pek te tu wange ki fainga mari ko ni ko na wai na fai to ko ni lahi ko ke operate ko ia o uta ke o atu ki tonga te ko pe ke haloti mo kata ko humai au ke ha mo fare atu ki he tau CEO me customer ko na
malo Fatima patombo ate watap ke ho iki mo kai nga topek mamata mai he te tio ko te ke ha me alahi CEO ke de mete ko ate be lo to honga mo e whakamalo lahi ki he ke o ngau e fai me he na te he whaki he ngahi popo mo e fotu he ke whakamatala mai ke uhinga ke whaingo fuai e mau ngau e me he ni. Mai loi pena uai mau whanki tono no si peka ku lava pe o whakalelei I he tuunga pe I hena ala puloka. Si tokoni lahi mai ka mau tolu heni I he ngahi mea ka toa na e whai mei tonga na. Ka ku ke ha whehui ko whakamalo pe mo whiawhia e si atu he whiawhia e ngai whaamiri ke he pe mei tongana I he nau o mai o piki e nau uta mo e nau whiawhia ka pau nau whiawhia pe hena ku mau whiawhia ko mau tolu me heni mo whamalo a teki ho kau ngā ue he whunga ue lahi mo whai mei hena he whakaatae mau kontina ke si I lava mai ka inga mo family o pike na uta. Ko ia pe malo o fa pe ke tapo kina mo tolu he o tua ke atu ai vilahi mo ke hoko atua e seni ate mau container ki tonga he kahau.
Ia, malo la he pito, mo ne pito ke whakamawhana lai whenga me kakai ko hiwe mau mai mo no ngai uta pa ko mei no pek Pafo ofa au pita. Ye standard marunga na au mei. Pia kubaba pita ngawe ape kono tunga tuko ke kakai. Ko tu do fe mo ina ta tau fe nga ko ni. Ko tau Fetoko ni aki ke ya umai na i ofa be hatapa pe Americana ya umai ki hen pe time de tal wa na wa ka kai o ka ki hoka par pare ma ko ke more hame o ka ki te fa ke o pe ko me na na ya to ko ni pe ala ke ni heni ke le sio pe ko me pe ke witness pe ke me ka to o ku ke ya me ko me mo ina ka na te ase me ko ni ko te me na ka ofisa ko fa wa ko to me ko fu pe pa ko me na no fi fia ani ko no ko ya toka ngai ki na makehe pe muri ana o fai pa na no fi fia ko ta pito foi pe na ko na ase mai na to fa ri ko tu ko dan ai to ko na ma ke fa pika fe tu ni fa mara tu to ka ai mo to he ka kai ma ke me ai ko fi ma ba ke fa ha tu mai fo ki mo inu lahi ko vai ko ngai puha ka pai ka sai a pito ke ma me to ni e na fi fia de ta mo ma ke ta to ne me mo inu pe mo to e pa ta ho mo ngai fa mi fi ma me ko ni mai ko tiene ko ni o te tu ko me na mama ya ta ya la ka ta ya fa la ya mo ko na pi na na wa ri ta ma si na fa ba la ha ta ke te hi ki me du wa ye inu Arizona mo dai du la me fa fi ye dau no pe fi dau ni na si ka to me ko ya pe me no ko ko PPE no PPE ko na mai ke te ya fi ala ya ke ka we to la ko hi ko mai pe ku nga ngai provision pa che ni ke mam ya ka wi fo nga we ma nga ma ta a ki a pa te tolo ya pa tu me ai ko ni pe ku wa we no use up nga be ko mai ko pa nga pu nga ka ko te ya ko ni ke fa ai bi la te ma te la bahina ni tu ko to ko ni ai ko tala mo ko pini ko ngai puha ko so ko sanitizer ni ko ska mata nga ga yo office mai pa tu fa ke ta mai ki ke malo ide ki na to ma nga pita fa nga we ni we be fa nga na positive pe ko ta al pe ko mo abi ka ke asore di ka nga we ko ye pe positive al be mo ne na we o ta le pa to fo mai ka ko ni ko o so fo de ka so dia ko ke na te me ka polisi pe mo ka mo we mo ma to mo ke le ka ko to ko ni na mai na fi a ku to ma be to ko ni mo i no ma ka pe ke na ina tu foko fa statistica che la ta contiene ka minusila ko ta mi ko America ko na ko fika wa ala ka ya seria pa mo fis ai ba nga nga tu ba nga to ko fa pe mo sio ko seria ko pe nga ko na ko de na te ha ka America ko mo sio pe nga te ba ne ka pe America ia ko fa no pe na ke fa pe mo mai nga ia ki to mai to ko ke ta off ko na via ko to pe ke ha ngai ofa ke ha ngai family ko no mori fu mama ang moto ki to ai de ha ko de mama ang ko ke ha to no mai utai ha to no mai to man ko ta ko me amiga la ko ka to ya mo e to vilo re ngai va ka pasifiki va ka ko ni vilo ki fisi musi la seria o to te na to rio no a fe ko piki me uta ko ni America and sometimes va ki fe la delay ko inga ko ha ke va ka e me before mu ya ko pa ko te na wanua ku America ku pang kawa eto wa ha lima ko ka fu te ta to wa te va ka ro ko ti mai ka pe nga ku now it's very uncertainty of the time ne ko ta pe na to ko ton ke ta wa te a me ton ke ta wa me e wa spe ya he ni to ta ba ka kai e ke ma te ko si ta ma ko te na ma ri ka ta ke ki ai ko me na sta ma na ka ma na ko o si mo ha mo e ke na to ilo ai me ko ko ma ma ni tai min i mamani he ve uru ake ngai waka a o pe ngai container ka go ne mo we sia ko ya ka go se pe ka tonga not pe ngai me ka me obliga ki o ka pe ki wa ve mai ai ko ya ka fa matala ko ke ngai ta ni tu ko tai mini ba
malo apito
Iyo, malo apito. Haloti ko tahai ni o toko tahana na fe toko ni akilahi apito kono whaka mā opo pe a moe aike māu a hono leipo kumi mai utalamu fo o ke ngawe aki. Pe a neonga pene os kumi mai utalamu ki mua ka nai to mai utalamu fo o koe ni ko ngā ke fo o katoa pe a māu hono atu te toange whangamaria ko ni ki a teia. Halot.
Io, malo pito Fatima, kore peke ku whanga pe ngai whatap ko o si a whaki me Pareni. Koe kea te wharoro atu ke re mete koe hangelawa te ko koe whamaro ia pe ke te koe mo kotoe kaunga ue. Pa pe whuki ke ngai wā whengawe aki ai customs. Koe ki te ama mea te whetalatu koe mau whamaro ai pe ke te koe mo kotoe kaunga ue no kotoa. Hangelawa te ko wai pe ngai tō no e ta whaka mau tolu. O ku mau wako me wha container ko ni pa mau whampe ko e hoko atu e te rere angi. Ai mo whinga ki te whamapopo angi. Ai ngahi tō no ko ia ka koe whakatoa. Ko e mau whiawhia pe he tohi mai ngahi whamiri mo sio ki he pose ngai whamiri ke nau whiawhia lava ke mau e utai nau ngai whamiri. A koe ai o ku a te taramonu ke te koe ke mete mo kotoe kaunga ue. Pai tau pe kinang moto e ki whaka i wilahi. E hoko te ngā ue mo to koni ke tau whanua. Koe a pe malo.
Io, whamarora hea tau pito patoko ua honi ngā mi Amerika. E kono mori pia kama mpo whakako atu. O ulai pa ngai kai ngā whetu, e kontena kau ngai whetu ke hawe Frisco, hawe pei, mga mea pehe. Ka koe kontena koe hawe si ato. Mau mo maa popo pia maa, ngai pini, loka lele, ka whewheka no. E mo loka e ngai tawhake ngai pini, mo talamu, whewheka ne tuhu. Na kono peki mai koe he kontena, whakafofa pito pia maa. E ko whenga lahi koe loko ngā lahi na whaimi e na wako whamaro lahi ata pito. Wawa pito mau ngā ue, i foi tuunga whakafofo koe na hawa ke uta tuutahi. Ma whakawa whaka ke ko uri ke he ni mahi ngenge mau suka tamai kia na masi. Mea maa moni ka ngā koe ni mi Amerika. Tau pe whakaulaka pia ke whaka watu. Koe maa pe koe ngā ue, whaingofu e tau whenga ue aki. Koe kakai whokia neo ngai pia ngā lahi te tau whai o ngā lele tau whe. Ka awa re pia ko mōre pia maa maa na utai o si mōre na whalala mai na toka tau tau. Ta koe mea aia maa au pita pia. Ko wha mea ko pia hoko, paka mea kai whai tai maa toro ke awa ngahi. Wito klip ke ngai toi ngai kai whorua koe. Maa koe laulau mi sore, ki laulau mei whe. Ke nau sio ai ke anga kono peki mai. O mo tā koe si kinga maa o runga au pita. Ko mea ko trade. O ki makehe no, anga no peki ena mawhi awea ke ngai wahaku whunua. E koe ngai whunu ngai whi mea niwa o tui whana. O peki pēha nge ko haiki ko ngā abi uta abi koro ia whaa koe mea whakaholo pepo. Whaka tae mau ngā ue, kai ngai subject ke mau e koroa. Ka unu whetu koro. E koe ku whamaro toko ua maro apita e ngā lahi peki ena.
Koe taha pēia reason na live i mai ai ke re mete huinga ke whakamahino i ki o tau kai ngā tonga me he ngahi whetu ke he kone o muna o tupu aki i o kai haa e kau ngā ue i wafu. Nei ai ki example nei ki pit ai talamu ai na e whaot me he ni pēr whakaawa koe ke CV kua holo u tāia ki lalo. Aia o iai pēr ala si ala puloka o wile vai ka ngā oe ke ha o sio. Ai o mau sio atu, koe wholau at koe wakame ungahi wheituko i murini, o koe ke pehe ko ha puna waka puna ke no molo alu e talamu, ka koe whanonga e talamu o alu loa i he waka o tupe i he waka e mea o holo taki lalu. Ai koe taha pēia e mea na whe mauai ke live mai ke mau sio, Maua pito ngā ue me hena. Pak mau wha malo ai ke re mete. Ui ngā ku kai ke aha mau tuku aki i atu e kau ngā ue. O ku whawho o whai mea kātoa pia whaingofu ai ke tau whenga ue aki i he kaha u ko ia te malo.
Io, malo pita no hake i siu koe, ka kumoni i hoki. Koe kontena whakaheka hei maka. Pia lere mahi ta. Pia whura mahi ta. Ka koe ke whakaheka pa lere mahi halawarita ke oto i ngā ue.
Ko ia.
Ka koe hoko. Ka koe hapoi ta ia ka pao kake maa po opo whulere i hono whawa. Tau ke he, ai ko o mea moru ila lo ka kolo mama fa o pau ke lulu ia au hifu ila e ka ko tu ma ata haia ka mo fa matala na ka ke mawala kia e ko ke fa ka ia ai
Oh, yeah.
mo ya pa tapa o pito ia ka we la o te ke au tapui au pito ke ala ta ke kolo ka kai ka ko pe na me fa teknika ne me na ke mai io ko ia o lulu pe utai va ko foi fa va ke de gusto ke ha ni se o fu de ta la ka ko ana pe ke sai to no ka kai pa sai hen pe ala pa me ha fa ko funga ke la le witness pe tai pe ko ia ke ta ta wa tai independent ke ne fai ka pa su pe ia o ko be ko ia o ku ka ko ke pe ia fa ko uta pa ha o ma ko pe he ma ko ba pe ia ko na bu ha ki to hi ka ave ko fu ka kai pe ma wala ia ne o ka ki hoko me ko ka ki mau te ai ki whakawhikiki e te āsire e whai rau rea ai. Ka koe mea pēia ko kore pe e uhinga ko ia ke ka pau mea mai a kai wa Amerikana. Ka wau koe ha taha o kua mani uta whakahapa ni mitongani e tūnga o tai whee maari mo whai mai lao ngā kia te au whakatonu. O wai o ke mitia mo iau pe ke lawa solonga. Mea pe mau iai ke tō hifo mangari kō. Mea ko whee mau ki tau ngai whataha. Mahako mai ka te au koe whonga whakarao i o whai aki. Ono hei tōna ngai mea pe ki au sangi ko wa ma o fio ki ki he mooni. Ka mooni pita mea mura hoko pe whanga mea kona e. Ai toi awa ke ko si lalo e uta hia mea pe. Malo.
Malo.
Malo pito ke le mete ko hange pe ko o ngai whamatala kona o mai. Na ia e taim lahi ko alu he mau whakau ko ngai mea pe ia mau whanongo i koe i Amerikani. Ko e pehe whiko ko alo te putai o tai mau ia pa more na uta na utolo. Pea ko iai na e whai pele le taha. Pea ko mea ia na e whai atai whakatangi ke kau mai mo e polo kalama i he wiki ulaki ko ia o maasi. Pea ko whamore wiki wha osko ia Februari. Ko ngā ke mau whanongo hanga tono tu ka te koe ke anga ngai whotutu. E taimi koe na ke whamatalai mai ai na e mui lewa mau komiti aia o takia i koe na Michael Haloti Puloka, pepe foki kia teko whainga. Na e whairewa e whainga ke mui i ki heanga ngai whaunga koe na upulawa koe ki o atu. Pea koe ai, o mau whia ko ngā koe i kuna. O whia ho mau loto, kai ke ngata pehe ne au. Ka ko i ngā mau whia seo atu ki he whaingo fua ke kau ngau e kastomu. Ai lava ke tau whengau e atu au le rea te uta. Mau whawheta e mea kotoa. Pea, koe ai, o pusi e lea, ka mau whamalo mo e loto honga ia moni. Koe te tuka tēne ki whangamari whaosko ni kia ki moua teko pa pe foki a Haloti Puloka. O ku te waki foki e mau toi container e taha e kaha uwawe mai ke toi oaki tonga. Ka kou tui pena piaha mo ki i hau te ai pia whawhiu i pe toi aha mea lili, poka hanaha toi mea e toi toko niangi ke toi pese te au e mea kotoa. Kai whakawhita i pe koe nong tau whanonga tonu ki he CEO, ai nau whia he mau ai o hata e uta. Tuka teka ki moa teko pe ke Haloti.
O peke te ai ha whehu i ku kona ku o si whakamahino mai pehe e CEO fu maua pito e tauta. Pea koe ki mea pe taha ko tokanga ki ai koe tauta ke ka hau ke kau receiver mo e kau senda gon me Amerikani ke ka tak mole o te moho haasi e ai custom pe koe shipping company ke mo whawhanonga mai pe ki he okmau on top pe i he everything whenever we get words we'll update you guys as soon as possible but just on top of everything turned out good and mau whamalo atin ki he kau senders pe he fo ki he kau receiver he kai ke na ohalaki ki wafu o whakake ai mahino mai e whaingo fua ai whaotalamu atu hono whakawhike whika. It helps us and helps the receivers, especially ai kau ngā ue koe i wafu. Koe ki mea pena ma whatonga te ma fix pe mo Haloti he next container ke to e waweange a hono disperse ai utalamu ai kakai mo e whamiri i tonga. But overall, ke re me te mau whamalo at whawhonga ea te mau Palestini, mai mau tokon Palestini i he ngahi tokoni ko toa peo ke you actually give us i he kamata o e whotutu o e sene te mau container mi si ato. Ka koe kamata and we mau learn a lot of stuff me he for i shipping koe ni. Maybe the next one will be different. Ko masiat muhalo si he funky idea he kaunga oe I wafu. But we'll keep in touch with you on that malo pito mama o falahia ka koe. Mo kaunga oe.
Ia, malo.
Haloti?
Ia, malo Fatima, koe lau ke metkai te whe mau ki te wharolo ku ilo peo ke mau maua. Ka koe oku atu pe ai ke mau pe ai mau I meiri ko ha mea te mau lawa toko nei ki a te koe mo e kaunga oe. Hango e lawa te kou wai ngahi nau oku mau pe te mau lawa toko nia e ko mo ho kaunga oe. Te oku mau whakau ke mau toko nia te tawhako I hanga koe gloves koe overalolo. Ngahi mea pe he.
Vest.
Ka piaha ngahi mea oku ke whakaukau ke mau ke mau tokoni atu ai oku whanga maria o pito a ke hangpeko to tohi mai pe I meiri ke mau lawa tokoni atu ka koe whakatoa hange lawa teko mau whawhunga te mau Palestini mo tokoni Palestini mo komiti Seattle Tonga Relief Committee kawai a Fatima mo mau ngai family e whamalo lahi atu ke te koe ke mete o to kaimi mai he mo min konigi e kau mai I pōkama ko ni. Ka ko ia tu whamalo ke kainga tonga kotoa pe I wasinga toni. Mo whalala ki komiti ko ni ke whaiha toko ni ke tau kainga I tonga. Ko ia pe malo o whatu.
Ia.
Malo pito ke mete ko ilo pe ku no tonga lele ho mo ngai interview mo ngai project e taimini. Ko e wharea wha o se tupe. Pau ke pe ki aha me e toi toko ni mai ka ki mautou ki toi whalala kai pe mau ngawe mo tau whinga e aki e ka hau wha whao pito ka ko mau whiawhia mo loto honga ia ia hangi ko mea kona e vahi mai e te ko o ku mau inga pito ka inga hangi ko ini ko tau whiawhia na e pehe mai o ku ki tonga ane na e alot na kai to hifoi ki lalo na alot pe pa ta alo mai ki holo muia te mea lere o si o atu pe koi foi fika na o mai o holo mui mai ai na forklift o whakaheka ke mea lere os pe aloi pe. Ko pehele wa fu to atu fu matikitika pe to mo ngawe pe mau pore ai pe I ngawe lele mo whahoko I he wafu. Pea ko ia pe kelemete ka pau te aha mea ke vahe mai. Pea tokoni ka koe hanga mega na lau te ko o mahu inga apito I he e kainga whanongo ko tau pe ko e tau container koe hoko, ko pau ke ilo koe toko taha koe ni o lava o alu ki wafu I tai mutau a tai waka o alu ke piki apu mai e nei uta. Ka ue tuku ai he kuhoko e ko toi whakangosia ki he kau ngā we ko hono toi whakasia whitu ko toi ai o nau toi story ape e uuta koe ni. Koe lelei taha koe ne tu uta tupe, tuku atu he reti o hange koe mea koe na e whahoko e keremete. Pea mo kataki o mea haki o piki apo mo ngahi uta ki ua toi hoko ni koe nau toi nofo re ohi mo siof. Pea o ia ha mea whatamaki hoko ki ai te mohane mo to tuka ki kau ngahi kastomu pe he nai more ai uta mo ngahi mea koe ia. Ka koe ia pe ka ma whamalo atu au pito keremete tuka pe ki whangamari whaaskoni ka koe mau ofalai atu ke ki motol mo kau ngawe he wafu mo ngawe lelei pea moe ngawe au whatou mo whako, whamalo tēne ki a ala ki hifo puloka I he tokoni lahi ke whakakakato ngai whatongia malo.
Fuko.
Keremete.
Ia, marapito Fatima. Pega motor kaga. Uragi pe first and foremost really appreciating our Whai committee bihena. And let's put everything in a more organized way of packing the thing, receiving from the people, it's all depend on committee of photo. Ko lo peo ke ngai vai fo no ko ki lo kana ko mi tu hangi pe o mai tau ta da be. Ka ko lo to pe ke ha ki o ate me ko ni. Ko ngai container ko ya ha to sila hanga to ma ke ni mo. Angi ko container ko na mo to. Ko sai pe ke ha ta ke lava ma fiu ta yo. Angi ko ha mo ko alam na be ke ni confirm be depende me ma mo to. Ka ko container ko ha ko he ni mo. E fai ko to pe e ma to lo me ko to. The government will bear all costs. E au he no. Kau ngā ue mo hafu mo hafua. Pea ka pao whi mau tau pihe ma hata hea mi hena. Mi Washington ni ne pua mo hane talamu ke alu ki wawau. Government will bear the cost of transfer to wawau tako ia. E mau au kuita pe ia. Au ki e ua. Ai wata me hata hea hena. I Amerikana. O kune maha mea ki hengahi motu. Mauloka maro matolo he to transfer pe ki waka arwai ke moto. Ai ko anga tu kaku sai pe ko ta beta hai ai fa fofonga ai ba fofonga tu ha ko to ai na we ya. E wo me ka kai o fa mo ke fa fofonga ka ke fa mo me ka matolo ko mo fa nga we ke va ya ni mo no fa ko e ko mia ko to fo ki wa ko ne tu ta pe ba ka mo finga ki mai manifest ke mau si ngai kon de na ko ka ko to ko pe a fe ka ore ke ni mo mai ai mai mo fa hu mai pa mo ha ma to ri fa ka ha ko program ya o de hu ki tu wa wa ta mi da hu ma ka fa ngai ta be o mai ai ma ke fa ngai tu ha o ho ri ke pai pa si mo si ha ora ngai ko tu ko ki pa ku fa ki pa ko mai ki pe ko ko ka ko ke ho ko ha mo ta ko ai pe ui ko pa whanau ma Amerikana ke museo kana wako mai fonga ko fai misiato ma o me ko to o ha pe ala si o ma fenga o ko ki ha ala ia ta ma ke pe mo pe e ko me mai no pe ka ala ia nga o ma ka ma to o si o ki a da pita nga we to ma o te ha me o fai e ma to ka ma o ia pe ala ke fai ta e si o ka be ka na ka pa fa wa ke ko ma fa wa ke ma to ha me ko ke fa fi mari pa fai ta kau sai pe a ta pe ke mau fena ani ko ya ka ko da bottom line ni ko ngai ko kau ke ngai kau ta ko pa ke to tong e fi ai progress ngai fa pro to tong e fi service fi ai ngai kau ta ko ia ma ia mo me ko to hanga to no he ni mo ko te me to to au ke tu ha ni o ko te me to to ke te fu fi ma fa ya mo to hela ia mai ai kamen be all cost de tu to me ko he ma ko bia be fausi ali pe io o at mate au ia fa maro mi hen pe mi ko na buto ko mi aki io kaya to hina vai ma to ka pa Arizona na ke to be fa vai pe a buto ki doi ke ngawe pe mo PPE COVID will be in tonga for long ko di lo pe na to fa which mean ko pa ke mau ngawe ke na PPE ke malu ki mau to re kai buto be Pega pau kara mo mai family a moia. E fai na me be ke protect pe ka ngawe all cost. Ke ona i ku o wesia ta pe ku mo rea ha mo. Ba o su malu ka to we tu ni ku tu na we. Na ma le me na ma si ma do tu o we. Ne positive pe up. Wo mai no ko sila control up to pito ma di tongan ko aru ke sai up to bit call up to fai na ko in fact on a daily basis. Ai ba ko be ai wa ka ke fi ma pe ia ka pa te pe hana nau PPE hena ala ma mai we are looking forward and we appreciate apa apa ka ba ma fa o si be fa ta pe ta ho wa pe ta fe nga aki ka hau ko ke na to ko ka kai ma na pe to ya mai ki mo to ko e kai nga to i na ke kai nga to i ni te ku kau he motivation mo ui na fia ui e wa ha fo ke ui ko he ni hange ko tau ke ya ko ke si ui ko he lava he si ai ko ris ko de ui ai no bravo no fia tau pe me ui fa ka tau pe tau fa no ye ka so ui me ora tau si ta la mu he a honi no fia e o ma ko ba na ta la mu ba ke ko wa te fa ma ro na pe ko mit ma ro pe nga bi america ba o fa pa lo
Halo.
Pito. Mau ofat ke mete ka ko pe foki ke ka nga e customu. Mau ofala ya tu pe me Seattle Tongan Relief Committee pe me Seattle Washington America. Voice of South Pacific. Malo o pito.
Aro.
Ta e te pene tau fo i fasko ni ko tori fisi. Fa o sea ke tau por kalama ko e ahoni. Tu ka ai hau sei. Ko ia kremete ko e ma ko fa mari pa tu ko i mai pepe a moho o i meiri. Ko ngā ke whaingofua e whetu taki ai. The last Tongan song. It was composed by the late Queen of Tonga, Queen Salote. Thank you everyone, for being in the broadcast of our Voice of South Pacific broadcast from Seattle, Washington. Namotok me amaia kia Michael Haloti Puloka pefoki kia nesteko whainga tawali'i, all the way from Seattle, Washington, USA. If there's any little glitch, we have a project manager for the King County Public Health, which is Tausili Kalepo. Thanks a lot, for taking the time to put this together, because the tech, is not available. Thank you so much, for putting this together. It was unbelievable. I thought that we were going to be able to make it, but thank you Kaasa ke ki ngongo koe ni koe whawhe I atu e kasa no walutui o whakahoko ai birthday a hono moko puna e ato naki koe ni koe ato noa e peleli. Ato noa koe no e peleli whahoko ai ki mō puna koe ni o siwa pia mō teisa. Ai koe ki I o whewhine o siwa mō teisa pia o ku whahoko ia I he tuasila ko ia ko e ua wha ua noa tolu, hala taha noa wha Avenue Southeast. Ua wha ua noa tolu, 104th Avenue Southeast I Kent, Hivavalu noa tolu noa. Ua wha ua noa tolu I he hala taha noa wha Avenue Southeast I Kent. O wha hoko I he taim tolu e fiafi, ko whaafi mai pēni a Casanova Lutui, ai koe mga puna o Casanova Lutui pia mō kato. Whahoko ia I he taim tolu e fiafi a ato naki ko ia uikeni. Whawhi atu heni mō e vange koe mao mea toko ne pe mō fiafia I pe whakataha mo ki mō ui koe ni. Ko ne au sia hono aho wha elei. Pea kui kai kia ha mea koe wha ampe family. Ka po te mō ata mō mea ange ke mō kau whataha I he aho koe aho tōnaki a o wikeni, koe mawai pe ki kiri I puaka pa ngongo ai pe. Aua, koe birthday ia o ki taha ki uhiki o siwa pa mo teisa I he fiafi tōna ki e taim tolu hoa tai fiafi. Whawhi e tēni ki mō tolu ke mō kāwan ko toa sila. Hua whaua noa tolu I hala taha noa wha Avenue Southeast I Kent, Washington. Taim tolu e fiafi tōna ki a wikeni. Whakao se kai pē tōna ki ma uha o ki mea tokoni. Kai kiri puaka pangungungu ai pē mo ngahi mea tokoni. Ifo mo ami o ko ia kautonga mo celebrate ai pe ai birthday ko ia o iki mo puna ko ni o Casanova pe mo kato lutui ko ia ko tawa mai ni ke fa osinga ta por kalama fa malo la fo ki heni mo lota honga ia to ko taimi ai CEO ko ia custom ko ia atonga ke le mete vahe ke ne ka fa ta mo ki tau tolu pe fa malo te kia haloti puloka pa pe fo ki ka ne steko fa inga tawali pea mo e kawhata mo no foto to ko ia ngai whakaheka container ko ke kau pe ko a lele container pe ko ki motol ko ia toi si e ki ngai uta te ke pick up mo fra ampe ke koreat ke taha mo ngai family ke na me aki wafu o ave ho mo ngai uta o to ho ko ia ko whakamosia ki he kau ngā ue ko ia I wafu ko no tauhi o ngai toko ni ko ni ko a wat mi amerikani tau te fito ki Seattle, Washington, whakalata pe klasi uloaki ai mea hono kotoa. Ko iai, ko e whakawhi e te pik moto, tau kawhatahe ne polkalama ko iai Voice of South Pacific I he ahamoni te, aia ko e aho ua ia o me. Aia ko e sapate ko ni, ko e sapate whakame ia talamonu atu, ki e tau tupu kotoa pe, e ngai sias vesiriana, sias metotisi, mo whamanatu kui ko e First White Sunday ko ia o me sapate ia whai ai whakame ofa ke mo mao ha sapat whakame fia mo kresi ia I sapate ulaki o me ko aho ulaki pe ia o me to I a sapate honoa ko sapate whae o whamanatu ia whataha pe motonga tawa man ke whaasinga polo kalama ko whaanu ke take a little minute here and say thank you also to Christina Bradic. That's the communication specialist, from the Seattle King County Public Health, taking the time to always share the very important and relevant information with our Pacific Islanders community. Also, I want to do a big shout out to you, Tausili Kalepo. He is the project manager for the Seattle King County Public Health, for helping us today, making our program possible to be on a broadcast live. O lava peke mo ma o te tau e prokalama I he ata, I he Facebook, pe ko YouTube live. I he whahinga taimi pe. Mawa o mai ke whaasinga prokalama, ka whamalot ka ki moto ka tau pena tau kau whataha I he prokalama I he ahoni, ofa ke mo ma o ha wike eni, fia, mo mono ia, mo keresi ia. May God bless you all till our next program. Until then, my name is Sylvia Fatima Taimi Aho, and also ko Radio Tech he ahoni, ko Sili Kalepo, mo tokon lahi kone whai. Malo pita mo mea mai, ka mo mea. Ta e pene for ifasiko ia. The last song, just to say goodbye, tu kai ai hose.
Kai ai hase, ala me te kite, I toki loa hama e ni aku whai whelu te ni. Ko tu mai ha mai, ko mai ua ko, mali kai ho e no ko. I lo peta kai si lo mai le momo. Katau ka so O tu mai ha mai ku mai ua ko mali kai ho e no po lo peta kai si lo mai le mo katau ka so tu kai ai ha se ala me te kite I toki loa hama e ni aku whai whelu pelu te tu kai ai ha se ia me te ki te